Good evening, everyone. My name is Dr. Marwah Jenneker. Before I go ahead and introduce myself, first of all, I would like to take this opportunity to sincerely thank the Discovery Foundation for recognizing as well as supporting my research. This award does not only validate my work, but it also really helps me or encourages me rather, to push the boundaries of knowledge as well as to achieve meaningful contributions in my field. I am currently employed at Inkosi Albert Luthuli Hospital in Durban as a high-risk obstetric consultant since 2020. So aim in the unit is basically to provide high-risk women the opportunity of a multidisciplinary team, and by doing so we try and improve maternal and fetal outcomes in these women. So an important disease profile that we see in Albert Luthuli is cardiac disease. As we all know, cardiac disease globally is becoming an important cause of maternal morbidity and mortality. There is also paucity of data on this issue, and this made it important for me in terms of an area of knowledge that we needed to explore. So in 2020, I set in motion two protocols. One was a prospective study just looking at maternal and fetal outcomes in cardiac disease, just general cardiac disease in pregnancy. And then the basis of my PhD was anticoagulation in pregnancy. So just a background, rheumatic heart disease, which is the consequence of acute rheumatic fever, is still an important cause or acquired cause of cardiac disease in pregnancy in South Africa and low to middle income countries because of poor intervention in terms of treatment of acute rheumatic fever. Unfortunately, this disease causes damage to heart valves, and these women generally require mechanical heart valve replacements, and with the result they require lifelong Coumarin therapy or warfarin therapy. So a lot of these women enter their reproductive years on Coumarin or warfarin. We have noticed, a lot of women, unfortunately, because of the lack of pre-pregnancy counseling, the lack of contraception, a lot of them do fall pregnant, unfortunately, on warfarin, and warfarin is teratogenic for the fetus. So though it is safe in terms of providing maternal safety, in terms of the cardiac disease, it unfortunately leads to a lot of fetal wastage. And that was the basis for my work, because I then looked at a drug called enoxaparin, which is a heparin-based drug. This drug does not cross the placenta at all, and therefore is completely safe for baby. And basically what we wanted to see, and we wanted to compare it to warfarin and see whether dose-adjusted enoxaparin can actually provide maternal safety and at the same time providing better fetal outcomes in terms of less fetal toxicity, less teratogenicity, and less fetal wastage. And that is the basis of my research. And the data that I've received is quite interesting, because I believe that this data will definitely benefit us, the medical community, and all people who are involved with high-risk pregnancies, clinicians who are involved with medical disorders. This provides an important contribution to the current literature. I am saddened by the fact that I am unable to be with you this evening, but thank you once again for this opportunity. Thank you.
My name is Sivenderen Thaver. I'm currently a general surgeon, and I'm working at Dr. Pixley Seme Hospital. It's in KwaMashu, north of Durban. Through the help of the Discovery Foundation Subspecialty Award, I'm going to be starting my subspecialty training in surgical gastroenterology with the specialty of colorectal surgery. My interest in colorectal surgery began as a student, where thankfully or luckily I was in the midst of Prof. Madiba, who was a stalwart in colorectal surgery, not only locally but internationally as well. And I was luckily and fortunate to have been tutored by him as a student. And my interest in colorectal surgery then grew as an intern, having done my internship training at Addington Hospital. Following internship, I did have a keen interest in pursuing a career in general surgery from my earlier exposure as a student and an intern, and completed my training at the University of KZN, rotating through the various hospitals at the eThekwini complex. Basically seeing many patients that present to us here from rural areas that present very late with severe complex pathology and not managed adequately because of either poor access to resources or poor access to healthcare. And this gap in our healthcare system has motivated me to pursue the subspecialty training so that I can possibly make a difference and bridge this gap in our system. Pursuing this subspecialty training will really help these patients, especially in these rural areas, to receive the type of care that the specialist and subspecialist care that they require for their complex pathology. I was actually fortunate that some of my colleagues that I work with have also applied for the Discovery Fellowship, are also recipients of the award in the previous years. Seeing them succeed and pursuing similar avenues have motivated me to also apply and pursue this training.
Hi, I'm Shakeel Kader. I'm one of the surgeons in UKZN University. I work at Albert Luthuli Hospital and Dr. Pixley, Isaka, Seme Memorial Hospital. I was inspired by Prof. Madiba, who started the colorectal unit here at UKZN over 22 years ago. And it was the first colorectal unit in the country. My interest in the research that I'm currently doing is on the effects of genetic diseases such as limb syndrome and FAP in our communities. And we want to look at the incidence and the type of disease process that we see compared to Western populations. I'm particularly interested in teaching the undergraduates about colorectal cancer, as I feel it's a very important topic that is often mislaid and not explained thoroughly enough to our undergraduate students, in particular with the examination of patients, history taking. I think it's important to understand the risk factors for colorectal cancer. We do a lot of research currently on the effects of HIV and colorectal cancer in our communities and the aggressiveness and predisposition of patients with HIV with colorectal cancer. We're also working on another study looking at early detection of colorectal cancer with Columbia University, where we're looking at fecal immunohistochemistry, where we look for blood in stool. And this is a simple test that patients can take for, and they can do it at home or while they pass stool, and they look for blood in their stool. And we know that if we detect blood, those patients are more predisposed to developing adenomas and colorectal cancer, and those are the early signs for this disease process. Hopefully in the future, we'll become available to our primary healthcare clinics, and we can do this test routinely for our patients with symptoms.